Hello viewers, myself dietitian Chanchal Sahni and MSc in Foods and Nutrition, Nutrigenomics Counselor, Certified Diabetes Educator, presently attached with Dr. Ketkar Hospital, Mother and Baby Care. Wishing all of you a very happy World Breastfeeding Week, which is an initiative of WABA. WABA is an organization, it's a global network of organizations and individuals which are dedicated to promote, protect and support breastfeeding worldwide.
Hi, I am Dr. Pankuri and I am a physiotherapist by profession and I am into prenatal, postnatal and lactation consultancy in Nagpur. The theme for World Breastfeeding Week 2020 is to step up for the education and to support breastfeeding and to raise the awareness about breastfeeding amongst individuals, organizations and government.
As we can see, the triad logo is cradled by a blue line that represents the support system shaped by communities to support breastfeeding. At the end of the line is an arrow pointing upwards, indicating the efforts needed to achieve sustainable progress.
My role as a lactation consultant is to help and guide mothers prenatally to know their best choices about breastfeeding. Breastfeeding education and initiation starts during pregnancy. Lactation consultancy involves training and educating the mother about the correct positioning and the way to hold the baby properly for a good deep latch, because the latch is a very important part for adequate milk transfer. This prevents the mother for going into low milk supply as well.
Breastfeed is the best feed for your baby. It is the first vaccination for human life. My role as a nutritionist is to encourage and promote family members to encourage the new mother to exclusively breastfeed her child for the first 6 months and even beyond for 2 years with other supplementary feeds. In my practice, I often come across mothers who are facing difficulty in breastfeeding due to certain health conditions like diabetes, PCOS, high blood pressure, malnourishment, and so my role becomes to customize such diet plans for them, which helps them overcome their health status and also it helps them in becoming more fit to feed her child. Breast milk contains all the nutrients in the right proportion for your baby. It contains adequate amount of carbohydrate, fats, proteins, minerals and vitamins in the very right proportion. The good fats and good sugar present in breast milk helps the child to remain away from diabetes and obesity in later life. Mother's milk is also very rich in antibodies and white blood cells. Now these antibodies provide lifelong immunity to the child. Colostrum, it should be fed within the first hour of delivery to the child and hence we call it as liquid gold. It is an ideal nutrition for the baby. And so we see that the breastfed babies are much more smarter, intelligent and healthier than non-breastfed babies. They are less likely to suffer with sudden infant death syndromes, certain cancers, allergies, eczema for the rest of their life.
Absolutely, Chanchal. So, I think our viewers should know that just, 1 ml of a mother's breast milk or the first colostrum contains 5 million live cells, okay, and these coat the gut of the baby and hence they provide lifelong immunity to the baby. So, the mothers who breastfeed have a lot of protection from deadly diseases like heart attacks, brain stroke and uterine breast cancers. So, it's also being told in the researches that mothers who breastfeed are less likely to have postpartum depression as compared to mothers who formula feed.
Yes, very true. It creates a lot of emotional bond also between the mother and the child. In my practice, I mostly come across mothers who are unable to nurse their child properly. This might be because of inadequate lactation. The mother is not able to produce enough milk for the baby and the baby remains hungry. So here I would like to say that the nutritional status of the mother needs to be taken care of during pregnancy as well as after pregnancy, because as soon as the mother gets pregnant, the body's requirement of certain nutrients like proteins, energy, calcium, iron, it increases, and the body starts storing these for the later on lactation period. And if she was deprived nutritionally of these nutrients during her pregnancy, then she faces such issues. Also, during the lactation period, the demand increases all the more. It's more than the pregnancy period. The energy requirement increases, the protein requirement increases. So at least for the first 6 months, when we are asking the mother to exclusively breastfeed her child, so her milk should be nutritionally complete. For that, her diet needs to be complete. So here comes our role to give her the best diet plans and to guide her, educate her on what to eat, how to eat. Because certain lineage comes from the families, that there are certain myths in which they are not allowed to eat certain things, or they are even not allowed to intake too much of water also. Though hydration is very important for a good milk production. So here I would say that the nutritional status of the mother has to be taken care of for a good lactation and a healthy and successful pregnancy.
Absolutely. So, moms need to know that their breast milk is made up of their blood. So, if they are nourished well, they'll, make adequate milk for the baby. So, many moms come to me in my clinic telling me that, they didn't make any milk for their baby. So, which is, important for them to know that, their body start the milk production, process during the time of their pregnancy, especially when they cross their 14 to 16 weeks. So their breasts start to become bigger in size, and some of them also experience a little whitish discharge coming from the nipples. So that's a beauty that your body automatically is preparing you for breastfeeding. So as we already said that golden hour, the first golden hour, the first latch should be done immediately after the birth. So that from there onwards the child and the mother becomes comfortable, and they learn the innate skill of breastfeeding. So a lot of moms experience painful breastfeeding. They experience cracked nipples and low milk supply. And also a lot of times the child doesn't gain weight on breastfeeding, so they are bound to look for formula feeds and all. So being a lactation consultant, I help them to heal their cracked nipples and to make sure that they know about the latching process. So if the latch is good, they will experience painless breastfeeding, and so they will make adequate milk for their babies. Also, a lot of times the way the baby is placed inside the womb of the mother impacts the breastfeeding relationship, because a lot of children are stuck in one position. So they might have torticollis, they might have a little muscular imbalance in their face, sometimes because of vacuum delivery, suction delivery, they have nerve damage. So such mothers face a lot of challenges during their breastfeeding journey. So is the resort of everything formula feed? No. So that's where the lactation consultancy comes in, and we try to assess the mom and baby and give her tools that she can use to make it easy for her.
Ankuri, you being a physiotherapist, do you feel there is also an importance of exercising during the lactation period as during pregnancy?
Yes, absolutely. So, with continuous sitting and breastfeeding, the moms experience a lot of back pain, and this can also be a reason for them to give up the breastfeeding journey. So, we have to educate them about moving frequently. So, they can include micro movements throughout the day, some upper body movements, some lower body movements, and stretches to make sure there is blood circulation, so that she can feed well without any restrictions.
Great. So here, viewers, we conclude that a good nutrition and good exercise schedule, but under expert guidance, can make your motherhood journey wonderful. It will help us in producing and raising healthier individuals.
Absolutely. So breastfeeding well begun is breastfeeding well sustained.